You actually had a piece of commentary today about unemployment insurance and, of course, the latest jobs report. 8 million removed from unemployment insurance, obviously, last month, only 194,000 new jobs. By the way, I feel like you were really quick on this because didn't the jobs report just come out literally this morning?
Yeah, it came out at 8:30. I knew it was coming out, so
Yeah.
I was ready.
Yeah, yeah,
You
yeah.
set the alarm? You set your alarm?
Right. Yeah.
Yes.
I kind of figured you were like ready to pounce on this because you have been covering unemployment insurance, obviously, since it was about to be taken off. So I want to bring up just a graph from People's Policy Project, which just I think is a really stark depiction of how many jobs were not gained after all of these people were thrown off of unemployment insurance. And I wanted to ask you, what does this tell us about unemployment in this country? Because I think that obviously, whenever we hear about politicians who want to throw people off unemployment, or even when we look at some of these programs like, cash welfare in the 90s, or, like Medicaid in Arkansas, like just a few years ago, where politicians want to attach these very stringent work requirements to these programs, the rationale is always, well, we need to get people back to work. We've seen that doesn't work. What does this tell us about unemployment in this country, and like what can we do to actually make it good?
Yeah, I mean, narrowly, I think the pandemic is an interesting situation because it's so novel. You don't really know what's going to happen. So, I mean, it's conceivable that these cuts were quite brutal. I mean, cutting people down to $0 of income, like 8 million people in a few weeks, cutting them down to $0 of income, that's pretty extreme. Even other countries, when they want to cut benefits to try to get people out, they'll cut them by, 20% or 30% or something like that, not 100%. So it's not unreasonable to think something might happen, but it didn't, and we knew it wasn't going to happen because about half the states cut the benefits in the summer, and it didn't work then either. So I think we know that, at least in the pandemic circumstances, that unemployment insurance has not been an impediment to employment at all. More generally, the U.S. has very stingy welfare state, has the stingiest unemployment system in the OECD. Most countries, like we have 13 to 26 weeks at very low wage replacement rates. We also don't provide any benefits to new job seekers. Like if you just graduated from college or something like that, you don't get benefits even though you're looking for work. We have a very, very limited unemployment system. And our employment rates are not especially high. They're not impressive at all. I mean, most countries in the OECD have higher prime age employment rates than we have. So whatever it is, it's, high employment is definitely, or I should say higher employment is definitely compatible with higher unemployment benefits than we have. So
Things you've been hammering on recently is the Democrats' proposal for paid family leave. I believe it was designed by Richie Neal. Is that true? What's going on with the paid family leave proposal what's wrong with it? Why is it bad?
Yeah, so the Democrats had this paid family leave bill for a long time. It was called the Family Act. It was one of those weird acronym bills. So all caps Family Act. And it was pretty simple. It had some problems, but the basic design made sense. You're going to have a Social Security benefit, just like old age pension and disability benefits. When you needed leave, you'd contact Social Security Administration, fill out a form. They'd look at your work history because they know every dollar you've ever earned, and they would figure out what benefit you were eligible for. And then about a few months ago, it started going through the House, and I noticed that, oh, this bill is changing a lot. And what it's changing into is they're now saying that employers who want to can create their own paid leave system using a third-party insurance company, so a private insurance company, and then the federal government will give them money to do that. So it's becoming very similar to our healthcare system, right, where you're going to have employer-provided paid leave insurance through a private insurance company, which the federal government will subsidize. And if that doesn't happen and you fall through those cracks, then you might get on a state plan, you might get on a federal plan if you can figure out, how to navigate all that. And what that piece I think you were highlighting, I've written a number of pieces on this, but in addition to just why are we bringing private insurers in this, it just doesn't make any sense. We don't need a private company to profit off of just literally sending people checks when they like have a kid or something, that's a pretty basic thing any government could do. But in addition to that, they designed it in a very goofy way where what they're going to do is if you're an employer, you will get 90% of the average cost of paid leave per employee. That's the amount of cash you will get. And the upshot of all this is that employers obviously are going to have a wide range of actual costs for administering paid leave. And so if you're an employer who has a lower than average cost, for instance, you have a bunch of low wage workers who are not going to get very high benefits anyways, then you can essentially pocket the difference between your actual costs and 90% of the average cost, which is what the check is going to be. And if you have above average costs, you can just not provide the benefit and leave that up to the feds. And so you get adverse selection in and out of this scheme, which means it's going to cost way more money. I'm not even sure the CBO has picked this up yet, but the CBO did a score of the bill and said it cost 20% more than the Family Act. So.
God. Yeah, I like that Richie Neal was just like, let's model this, what could be a very simple program after what might be the most convoluted, Byzantine, and hated system that America is currently using.
No, it's very bizarre. The Democrats like to say, if we were starting from scratch, of course, we wouldn't do the health insurance system this way, but it is what it is. And that's why we have to make these incremental reforms and can't do Medicare for all. And here it's like, well, you're basically starting from scratch with paid leave. Like a small fraction of the workforce has some kind of paid leave, but it's really minimal. Like this is as close to scratch as you're going to get. And no, absolutely not. That's not what they would do. They would basically just recreate the same system. And it's funny, when he put out the bill, he actually, they put out a list of people who support the bill. AARP gives a nice little quote and CAP gives a nice little quote and whatever. He actually included a quote from the president of a life insurance company. Oh, God. That was like, this is great. We love this bill. So.
If you enjoyed this video from Jacobin Weekends, please hit like and subscribe. That way, you'll enjoy all of our backlog, as well as all of our future content, including interviews, live streams, and clips. Thank you.